Hi, we are Group 2 from BSN1A FATE. In this video, we're going to discuss one of the nursing theories that help nurses understand their purpose and role in the healthcare setting. And this theory is from Watson's theory of human caring. But first, let's talk about who is Margaret Jean Watson.
Margaret Jean Watson. She was born in West Virginia on June 10, 1940. She grew up in a family community environment, and she's the youngest of her 8 siblings. Her true name is Margaret Jean Harmon. She took high school in West Virginia, and she graduated in Lewis Gate School of Nursing in Roanoke, Virginia in year 1961. She got her bachelor's degree in nursing in 1964. She became a Master of Science in Psychiatric and Mental Health in Nursing in 1966. She became a Doctor of Philosophy in Educational Psychology and Counseling in 1973. She is also the founder of the Center for Human Caring in Colorado. Suddenly, in 1997, she got involved in an accident and lost her left eye.
Let's discuss what is this theory of human caring. Theory of human caring. This is a grand theory which is broad in nature and encompasses the world of nursing. According to Watson 1997, the core of the theory of caring is that humans cannot be treated as objects and that humans cannot be separated from self, other, nature, and the larger workforce. She also stated that caring in nursing conveys physical acts but embraces the mind, body, spirit as it reclaims the embodied spirit as its focus of attention. And also, according to her theory, caring can be demonstrated and practiced by nurses. Caring for patients promotes growth. A caring environment accepts a person as they are and looks to what they may become. Watson proposes 7 assumptions about the theory of human caring. Number 1. Caring can be effectively demonstrated and practiced only interpersonally. Number 2. Caring consists of curative factors that result in the satisfaction of certain human needs. Number 3. Effective caring promotes health and individual or family growth. Number 4. Caring responses accept person not only as he or she is now, but as what he or she may become. Number 5. A caring environment is one that offers the development of potential while allowing the person to choose the best action for himself or herself at a given point in time. Number 6. Caring is more healthogenic than is curing. A science of caring is complementary to the science of curing. Number 7. The practice of caring is central to nursing. There are major elements of caring theory. Number 1. Transpersonal caring relationship. Number 2. Caring occasion or moment. And number 3. Curative factors. Transpersonal caring relationship. It is the foundation of Watson's theory. It is how the nurse goes beyond an objective assessment, showing concerns toward the person's subjective and deeper meaning regarding their own healthcare situation. It is also a special kind of human care relationship. Caring occasion or moment. It is a moment when the nurse and another person come together in such a way that an occasion for human caring is created. For better understanding, it is simply human-to-human relationship. These interactions have the potential to create a moment of transcendence or healing. Note: transpersonal caring relationship and caring moment are created through the use of the curative processes. Curative factors. Watson stressed that the focus of nursing is on these curative factors that are derived from humanistic perspective combined with scientific knowledge-based. Watson organized her work around 10 curative factors as a framework for providing a format and focus for nursing phenomena. 10 curative factors. They stand as a guide for the core of nursing that needed to be addressed by the nurses with their patients when in a caring role. Watson uses the term curative instead of curative to distinguish between nursing and medicine, because curative means human caring. These are the 10 curative factors. Number 1, the formation of humanistic altruistic system of values. Number 2, the installation of faith hope. Number 3, the cultivation of sensitivity to oneself and to others. Number 4, establish a helping, trusting, caring relationship. Number 5, promotion and acceptance of the expression of positive and negative feelings. Number 6, use of creative and systematic scientific problem-solving method for caring decision making. Number 7, the promotion of transpersonal teaching learning. Number 8, creation of a healing environment for physical and spiritual self which respects dignity. Number 9, the assistance with gratification of human needs. Lastly, number 10, allow for existential phenomenological forces and be open to mystery and for miracles to enter. Watson expanded the curative factors to a closely related concept. Caritas, a Latin word, means to cherish or to give special attention. She also provided a translation of the original curative factors into clinical caritas processes, which they could be considered and applied. These are the 10 caritas process. Number 1, practice of loving kindness and equanimity within the context of caring consciousness. Number 2, being authentically present and enabling and sustaining the deep belief system and subjective life world of self and one being cared for. Number 3, cultivation of one's own spiritual practices and transpersonal self-going beyond the ego self. Number 4, developing and sustaining a helping, trusting, authentic, caring relationship. Number 5, being present to and supportive of the expression of positive and negative feelings as a connection with deeper spirit and self and the one being cared for. Number 6, creative use of self and all ways of knowing as part of the caring process, to engage in the artistry of caring healing practices. Number 7, engaging in genuine teaching learning experience that attends to unity of being and meaning, attempting to stay within others' frame of reference. Number 8, creating healing environment at all levels, physical or non-physical, subtle environment of energy and consciousness whereby wholeness, beauty, comfort, dignity, and peace are potentiated. Number 9, assisting with basic needs with an intentional caring consciousness, administering human care essentials which potentiate alignment of mind, body, spirit, wholeness, and unity of being in all aspects of care. Lastly, number 10, opening and attending to spiritual, mysterious, and existential dimensions of one's own life-death, soul care for self, and the one being cared for. Watson defined the meta-paradigm of nursing based on her theory, which are the major concepts of the theory of human caring, which are person, health, environment, nursing.
These are the meta-paradigm of Jane Watson and how she defined it. And to understand it easily,
she views the person as the recipient of care and that this person increases their spiritual culture, family and friends, and even their socio-economic status. She acknowledged that each individual has his or own unique set of needs. She feels it's essential that nurses accept and confirm a person needs regardless of their costumes and beliefs. This is what she defines the person. Each individual patient needs to be valued and understood with the nurse. Patient deserves the right to have their dignity and privacy maintained and protected at all times. Health. She refers health to the quality and wellness of the patient as defined by each individual person. For Watson, the meta-paradigm of health means that the act of curing refers to more than just the healing of an illness but also includes mental and spiritual healing. Watson believes that although caring is part of the process of achieving health, it is much more than a physiological response in order for health to be achieved. Nurses must take a holistic approach with the patient. It is crucial to assess the patients based on their individual needs in order to maintain optimal health. Patients in healthcare settings. When working with patient is a large part of health, she also believes it should be addressed on a day-to-day basis. This is due to the fact that the health of a patient can change extremely in a short amount of time.
Environment. According to Watson, the patient's environment affects their ability to heal. While caring for a patient, it has been proven beneficial to the health of the patient to establish a home-like environment providing a sufficient level of privacy, allowing the patient to feel more safe and comfortable. Noise levels should be kept at a minimum as a result. Patient more likely to feel calm and relaxed. Proper lighting assess to nature and instill an uplifting feeling and reduce stress and anxiety. Lastly, nursing. She suggests that establishing meaningful relationships leading to patients feeling more comfortable and safe. Nurses should be leaders who are able to teach patients to take ownership of their well-being and promote better health.
To see what the theory of human caring and how it is used, we're going to apply it in a case scenario. This case is based on our research about Watson's theory of human caring. And this case is being an infertile woman in Turkey. The case was translated into English, and the Tagalog words that was used in the video was also from the English translation. This is the case study. Mrs. A Turkish woman who works as a paramedic, is 30 years old and has been married for 4.5 years. Although Mrs. A and her husband have been trying to have a child for 3.5 years, pregnancy has not occurred. As a result of surgical interventions and various tests performed over a 3-month period, Mrs. A was diagnosed with primary infertility. Following the diagnosis, drug treatment and sexual intercourse were recommended, and a 3-month treatment for 2 cycles was completed. However, no pregnancy resulted. Mrs. A and her husband had a 1-year break from treatment, and they tried to become pregnant spontaneously during this time. When the desired pregnancy did not occur, they decided to start the treatment again. As a result of the diagnostic test, it was determined that the couple would be suitable for intrauterine insemination, or IUI. Nurse point of view. First interview. After deciding on the treatment IUI, Mrs. A appeared very tense and avoided eye contact.
At pasok po kayo para makapag-usap po tayo ng mabuti. Parang kinakabahan ka po ata. Kung gusto mo po ng tulong, tutulungan ko po kayo. We have been trying to have a child for the past 18 months. Ang mundo ko na madilim ay mas lalong didilim dahilan sa paggamot na to. I am hopeful that you feel better day by day. Kung kailangan mo, pwede tayong magkita ng madalas. Could you please talk about yourself?
Pwede kang magsimula sa pinakamahalagang bahagi ng iyong katangian.
I have never thought this before. Somebody introverted, quiet with good intentions, I suppose.
Everyone has the potential to heal themselves. This is a hidden within us, and in order to find it, we should first know ourselves. Could you please talk about your inability to become pregnant or infertility? Ano ang pinagdaanan mo nung nalaman mong hindi mo kayang magbuntis? Maaari mo bang ibahagi sa akin?
My first treatment ended negatively. Later, I had a 1-year break from the treatment. Sa totoo lang, sinisisi ko ang sarili ko sa break na ito.
Sa nakikita ko, masama ang pakiramdam mo sa paghingang 1 taon.
Do I have the appropriate conditions for getting pregnant right now? What do you think?
The techniques that you have undergone show that your situation is appropriate for treatment. Kung meron kang mga tanong na related sa iyong pagpapagamot, pwede natin pag-usapan ito. I congratulate you for your efforts to have a child. We are starting a journey together in this challenging process. Sa pag-uusap na ito, sinusubukan kong kilalanin at intindihin ka. Ibabahagi mo ang naranasan mo. I will talk to you about coping strategies in the next meeting kung okay lang sa'yo.
Thank you for your interest and support. I felt lost, but now that I know somebody is beside me and has comforted me.
I'll give you my telephone number and also my email address, and we can meet whenever you want.
Nurse point of view. For the second interview, Mrs. A entered my room when she came to the unit for checkup. She seemed nervous, though not as much as the first interview. As in the first interview, I maintained the same therapeutic environment.
Sa nakaraang pag-uusap natin, you share some things na makakatulong sa akin para malaman ko kung ano ang tungkol sa iyo. Ngayon, we are going to clarify kung anong suporta ang meron ka at ano ang ginagawa mo para mapabuti ang iyong pangangalaga. Also, who supports you with your inability to become pregnant.
Ang aking asawa ay palaging sumusuporta sa akin at ang aking mga magulang. Sa tuwing ako'y may problema, sinasabi ko ito sa aking mga kapatid at sa aking ina. They've always support me.
The support you receive from these people is very important and precious since it contributes to your well-being.
I wish other people were like them. My husband's mother behaved towards me like an enemy. Sinisiraan ako ng ilan sa mga malalapit kong katrabaho at kaibigan because I cannot bear a child.
What do you think about this behavior? Anong nararamdaman mo tungkol dito? Ano yung mga reaction mo?
I usually keep silent and escape from the environment. Sa bahay ko na lang iniiyak. Minsan, nagmumura ako sa kanila para maintindihan nila ang pinagdadaanan ko. Dahil dito, nagiging tense at galit ako. Kaya, ano ang dapat kong gawin?
Naiintindihan ko ang tense na nararamdaman mo. Naniniwala ako sa mga sinasabi mo pero hindi ako makapagpasya kung anong dapat mong gawin. Kung gusto mo, maghanap tayo ng dalawa mismo ng solusyon. You're putting a lot of effort by coming here for this treatment. Una sa lahat, binabati kita dahil dito. What methods do you have developed and used for comforting yourself? Let's discuss them.
I need pullovers kapag super bored ako. Minsan naman lumalabas ako, but most of the time, I pray when I'm alone. Sa kanya ko na lang kasi pinag-ubaya lahat. Hindi ko alam kung tama o mali ba ang nagagawa ko.
Become spiritually stronger can help you. If you feel good when you do this, you should continue. Sometimes there are things we cannot explain in life, and this is when belief is necessary. Let's share then some of other improvements method if you like.
Nurse point of view. For the third interview, Mrs. A had reached the middle of the treatment process.
Hi, Mrs. A. Kumusta po? Ano po ang nararamdaman mo ngayon?
Komportable naman ang nararamdaman ko ngayon when having to test tube treatment. Hindi na masyadong tense yung nararamdaman ko unlike before. Dinala ko rin ang diary ko. Gusto kong basahin sa'yo. I also wanted to share this. My friend was 4 months pregnant. Tapos yung nakarang araw, she was knitting a baby shoe for her baby. Sabi ko naman sa kanya, dadalhin ko yung ibang pattern para makatulong ito. Pero alam mo ba yung sinabi niya sa akin? First, get pregnant yourself. In a very impulsive way. Tumahimik na lang ako and I just left the room. I was offended and felt bad.
What have you experienced has made you very sad?
She doesn't understand me at all.
Gusto mo bang maintindihan ka niya? May gusto ka bang gawin para dito?
Of course I do. Gusto kong sabihin sa kanya kung ano ang pinagdadaanan ko, pero hindi ko alam kung paano.
In this situation, using the iMessage or Messenger will be useful for you. What makes people become depressed is not what they live through, but the way they evaluate it. Paano mo nakikita ang iyong sarili kaugnay nito? Shall we discuss this?
Sa totoo lang, I am pessimistic. Kahit ngayon, iniisip ko ang mga pinakamasamang bagay na maaaring mangyari ng mas madalas.
Nasa kamay natin kung paano natin iproseso ang ating mga naiisip.
Nurse point of view. For the fourth interview, in this interview, are sharing related to continuing treatment process.
Mrs. A, you have been successfully applying the drug treatments. I congratulate you with that.
Sinusubukan ko ang lahat. Ang aking makakaya hanggang ngayon, pero medyo natatakot ako sa IUI. Since it will be applied for the first time, mayroon akong ilang mga pag-aalala dahil hindi ko alam kung ano ito at kung ano ang mangyayari.
Pag-usapan natin ngayon ang IUI, operation, ang proseso nito para mapanatag ang loob mo.
IUI is an intrauterine insemination. It is a type of fertility treatment that involves placing sperm inside a woman's uterus close to the fallopian tubes in order to increase the chances of conceiving. During the IUI procedure, the doctor slides a thin, flexible tube through the cervix into the uterus. They use a small syringe to insert the sperm through the tube directly into the uterus. Pregnancy happens if sperm fertilizes an egg and the fertilized egg implants in the lining of the uterus.
Medyo kinakabahan ako. Gusto kong magtagumpay ang IUI na ito. I really want to get pregnant and I'm very hopeful.
I think you have done everything you can in the best way for this treatment to be successful. We should remain hopeful and I am always beside you for this.
Nurse point of view. For the fifth interview, this is where during the IUI, while waiting in the room with Mrs. A after the procedure, I held her hands while waiting for the doctor. She was anxious because of what will be the result. I told her that I will be beside her throughout the process. Nurse point of view. For the sixth interview, Mrs. A sent me an email while waiting for the pregnancy test. Little time left for my test day and I waited until I felt a little excited to write to you. I think I have the necessary power to have a child because I really want this in the first place. I am going to be a good mother and my husband will be a good father. I think it's the right time. I can imagine the beauties of raising a person. I believe I deserve the title of motherhood. I will receive the result on Monday. Although I am not hopeful, I'm excited. Thank you for your help. See you. Best regards. Hi! I had noted the date of your test result. I would like you to know that I share your excitement and I am with you with all sincerity. I wish you all hope and excitement and babies with your family. Hope to see you and share your result as soon as possible. I congratulate you once again for your efforts in viewing life positively and learning to be powerful. I am sure you can cope with your problems in an optimistic way. With my sincerest wishes. Nurse point of view. For the 7th interview, during the pregnancy test, Mrs. A entered my room with a smile on her face.
Mrs. A, maaari ko bang kunin ang blood sample for the pregnancy test?
Excited na ako, pero hindi masyado. I'm hopeful. Sa totoo lang, I am ready for everything sa kahit anong klaseng resulta.
I feel the same excitement. Sinimulan natin ang bagay na ito na magkasama and now we're on the critical moment. Kaya mo yan, kaya natin ito.
Thank you for everything.
I would like to evaluate our past interviews. What have you been through since the last interview?
Pumunta ako rito na nakakaramdam ng malalang tense, kawalan ng pag-asa at kalungkutan. But then, I began to understand myself better with the support and help I received from you. Unti-unti, nare-relax na ako and also feel self-satisfied para sa magiging resulta.
So what is the significance of receiving such nursing care for you? What does it mean to you?
I feel special and precious. I saw somebody understanding me, being beside me. I shared my feelings with you comfortably. Perhaps I get rid of my heavy loads. Such nursing cares makes one feel unique. I wish all the health personnel I met were so caring and lovely. Sinuswerte ako. Pakiramdam ko ay ligtas ako. I know that a secure environment will waiting for me when I come here.
I try to strengthen you towards the feeling, condition, and hardships that you have experienced in relation in your inability to have a child. Support you, increase your self-efficacy with positive reactions towards infertility by becoming aware of your integrity and self-power and minimizing the negative influences. All in all, the aim of my nursing was to help you feel better. I felt that I could reach this aim after I have received your feedback.
In our case scenario, we focused on caring moments or occasion, or should we say the interaction between the nurse and the patient, and also we focused on the clinical caritas processes. We showed some of the clinical processes that could really apply in the case to help the patient physically and emotionally. As shown in the conceptual framework, every meeting, interview that was happened between the nurse and the patient has the caritas process. The nursing interventions happen from the interviewed process, the teaching moments, the giving advices to the patient, the procedures of IUI, and up to the treatment of the patient.
The step-by-step nursing process. So the nursing process is composed of 5 key components: the assessment, diagnosis, planning, implementation, and evaluation, which is also known as ADPI. The first step in ADPI, which is assessment, is the foundation of nursing practice. Assessment is when we're gathering our data on our patient. So this is subjective and objective information. Subjective information is anything the patient tells you, while objective information is anything that we can observe or anything that we do like lab tests. An example of collecting data is everything from basic vital signs, physical assessment, assessing from head to toe, as well as looking into the patient's medical history, their comorbidities, their past surgeries, their medications, their allergies, and so forth. And of course, it also includes labs and diagnostic data such as X-rays, CT scans, MRIs, any kind of surgical procedures, and so forth. So while gathering your assessment data, you actually goes way deeper, which you want to make sure you're also using your critical thinking skills, which is vital to form a diagnosis. The next step of nursing process is the D and ADPI, which is diagnosis. Nursing diagnosis is not a medical diagnosis. They are very different. It is not a nursing scope of practice to make medical diagnosis. The nursing diagnosis revolves around the patient's response to what is happening with them. It reflects not only the patient in pain, but the pain that has caused other problems, such as anxiety, poor nutrition, or has the potential to cause complications and so forth. It is important to note that nursing diagnoses are actually standardized. There is an organization called the North American Nursing Diagnosis Association, or NANDA International. They have made a whole list of standardized nursing diagnoses for nurses to use. Now let's move on to the next step of the nursing process, the P and ADPI, which is planning. In the planning stage, this would we develop our goals and outcomes for our patient. So what's the difference between a goal and an outcome? A goal is a general statement. It is very broad statement about what we want to happen. What experience do we want the patient to have? While an outcome is a lot more specific. It is measurable that must be achieved in order to meet the goal. So things you can observe the patient do, that's an outcome. When writing an outcome statement, make sure you're being smart about it. SMART stand for specific, measurable, attainable, realistic or relevant, and timely. Now the next step in ADPI is I, which stands for implementation. In this stage, you are simply doing the interventions that you came up with in the planning phase. So it is the things you will do or nurses will help the patient to do to achieve the goals and outcomes. And make sure the things you want to do are relevant, that they are actually going to help the patient, and also make sure that they are explainable. So implementation stage is all about making those goals and outcomes happen. And finally, the last step in ADPI is E, stands for evaluation. So in this stage, it is where you evaluate if the patient met their goals or not, and what needs to be changed in order to help them met their goals, or what new goals maybe should be created. It is really just reassessing your patient to make sure that they are meeting their goals, they are making progress toward their goals, and see if anything needs to be changed or not.
Now, let's discuss how the theory of Watson been accepted by the nursing community.
Acceptance by nursing community. Practice. She is an eternal optimist, and she writes from a deep place about the personal as well as the sacred. This philosophy invites to explore one's curiosities about the origins of call to care. What calls me to care? How will I respond? When is it hard to care? Who will care for me? What is the root of my caring response? Why do I fail to respond? How will I sustain and nurture my caring consciousness? Education. Watson defined her intent to describe the core of nursing, or nurse-patient therapeutic outcome, rather than the dream of nursing, procedure, task, techniques. Her framework inspired experience by emphasizing deep inner reflection and personal growth, communication skills, use of self, transpersonal growth, attention to both nurse and patient, and the human caring process that potentiates human health and healing. Research. Patient outcomes in caring transaction are a potential for studies. Research shall focus both on subjective and objective patient outcomes to determine whether or not caring is indeed the truest essence of nursing.
Hello once again. This discussion will end here. We hope that you learned something from this theory. If you are watching this and you are an aspiring nursing student or want to take nursing course in college, we hope that this discussion will provide you with the knowledge that will help you in the future.